Theracave, we don't just assess the spinal posture, we also go as far to assess the foot posture, which affects everything.
The talus bone is actually the one that makes the ankle joint between these two bones, the ball of the ankle. So here I'm palpating to see if I can feel that talus bone. If I don't feel it inwards, so I'm gonna give this a low score below and above the lateral malleolus. Okay, so I can see it's kind of congruent, they're symmetrical, so I'll give this a good score. Foot arch, if I can fit my finger under it, then I'm giving a good score. I can't in this case, so I'm giving this a low score. You can see the forefoot, the toes from behind. If I can see it, more outwards or inwards, I'm gonna score it based on that. In this case, I see it's more or less neutral, so I'm gonna give it a good score. For the protrusion of this bone, it's called the talonavicular joint. I can see it's too protruding here, so I'm giving this a low score. Next, I check the alignment of the heel. So you can see the end of the Achilles tendon and the end of the heel bone here before the heel fat pad. And I can see it's nice and straight, so I'm gonna give this a good score. So that concludes the assessment of the foot. That's a good way for us to gauge the progress of the treatment and help the patient prescribe the right exercises.